everybody, and welcome to Conversations About Change. My name is Susan Schifrin. I'm the founder and director of Arts Philadelphia, and we are holding these monthly conversations with longtime Arts Philadelphia partners in celebration of the fact that we are in our 10th year, and that's a big deal for a little nonprofit. And we would not be here were it not for all of our partners. And that is particularly true of the person that I'm going to be speaking with today, Hildy Tow, who is the Robert L. McNeil Jr. Curator of Education at Woodmere Art Museum. Welcome, Hildy.
Thank you. Welcome. I'm very glad to be here.
I'm very glad you are here. So we have been working with Woodmere for 9 of our 10 years. They are our longest lived partner. And what we are going to be talking about today is a celebration of National Creativity Day, which happens to be May 30th, as Hildy said, and I said, who knew? But it gives us an opportunity to talk about the partnership that we've had all these years that really centers on creativity. So without further ado, welcome again, Hildy.
Thank you.
I want to start by asking you to share with us your personal and professional connections with dementia, since we are an organization that is all about serving people with dementia.
Well, I do have a personal connection. My mother had Alzheimer's disease, and ultimately died from it. And the last 8 years of her life were difficult and challenging. She was in a life care community, but my mother was always a very feisty individual, a tough woman. But as you know, the disease changed that. And you know that it's hard. Yeah. It's very, very hard going through it.
Yeah.
You know, there were gifts that came with it that were totally unexpected. I don't know how much you want me to go into it, but I mean, I guess so much of my relationship with my mother, which was full of love, but also challenging at times, in the best of times. I always knew she loved me, but she could, like I said, she could be tough. And one thing that did happen when she, as it was first diagnosed, cognitive impairment, was that, and as well, it wasn't at first, but as time went on, she forgot why she was angry a lot. She was just happy to see me. So that was a gift. I didn't have to be worried that I didn't call her enough, or I didn't see her enough. My mom lived in New York, and I'm in Philadelphia. So
I'm so glad that you brought that up. This is something you and I have talked about before. We had very similar experiences with both of our mothers, who both lived with dementia. That's for another conversation, but it is significant that you bring up both the difficulty, the challenges, let's face it, the devastation, but also the opportunities and the gifts that come with dementia-related conditions. So clearly, you have this in your personal life. From the point of view of your work at Woodmere, I'm going to merge 2 questions. Why did you think it was a good decision if you still do, uh, to join forces with arts. So what is it in Woodmere's mission that suggested to you that this might be a productive partnership?
So my response to that is both professional and personal as well. Prior to becoming curator of education at Woodmere, I had worked in the education department as the associate curator for several years. And I had explored actually getting a master's. I have a master's in fine arts, and I am a certified teacher of art education, but I began to explore at Moore College of Art and Design a program they have, graduate program for special populations. And predominantly working, I think most of the graduate students there work with students. And I thought this was an opportunity to work with people with dementia. So on some level, I think what I didn't feel I could do for my mother, I could do for others. And I thought it was a community that need, I'm an artist. I work at an art museum. I feel that art is a very important part of, it's been a very important part of my life. I'm a visual learner. It has helped me a great deal, but also just seeing the possibilities of creativity and how things can change, and you can explore things that may seem difficult and out of your comfort zone, and become tough. It's a lot like life. Sometimes you feel like you're banging your head against the wall because you're not getting where you want to get or go, and you persevere and things happen. But I think it is also, as at working at Woodmere, being part of the education department at the museum, we're giving people the opportunity to be sensory, to trust their senses. We always say to children, and I say to adults too, because children are used to being questioned and raising their hand, but adults are used to knowing things and are afraid to say things when they don't think they know the answer. And I'll always say, trust your eyes. And that's where partnering with arts comes in, where I knew from being with my mother and others that I saw when she was at her life care community, that these are still sensory feeling human beings. What you see often is the frustration, but the response that art can bring, because it's there. It's just, it's colors, it's facial expressions, it can inspire memories. It can, even if you can't, there are people who, have aphasia and have a difficulty articulating, there's still this response. And I didn't know at first when I first met you, Susan, and we talked about arts, but I did know that it was a place where I thought art could really have meaning in people's lives. I did not anticipate how much, both for the people with the diagnosis and their care partners, and how much the care partners were part of all of your programming. That to me was just enlightening and wonderful, because it also, through experiences, I saw how this also created community. It's, we know it's a disease in which one can feel so isolated, not just the person with the diagnosis, but the care partner, in which one is often afraid that the person they love may be loud or disruptive, or it's unpredictable. Especially when you're bringing somebody to a new environment, disorientation is so much part of it. So when we first met, first of all, it was meeting somebody who also is, passionate about the arts, but was passionate about what you were doing. And I must say that there was this sense of, without knowing you that well, that this was about love. And you got me. But and to think that we could do something with art, with and it could be not just, it could be part of, I hesitate to use the word healing, but it could be part of bringing life to people's, enlivening, maybe that's the word, enlivening people's lives. And what was so incredible was seeing how, as a care partner, you see your loved one come alive in a way that you may not see day to day. And you're enjoying it too. And the conversations and I have said this to you so many times. We're sitting there looking at an artwork for an hour. I mean, maybe it's maybe we have 5 minutes left, but and it's been this journey that we go on, and we go on it together. And as much as I have looked at so much of the artwork prior to you coming and have given tours and designed programs about this artwork, what happens in these programs is I see so much, and I hear so much more, and I think about so much more, that it enriches my life and my personal and my professional life. I develop a different connection with the artwork because of this social experience.
Wow. Thank you. Thank you, Hildy. And I mean, you are one of our partners who has tried, and that's saying a lot, for 9 years, you've attended virtually every program we've done.
It's my favorite program.
But it's extraordinary. And I think it also brings some extra validation to the participants, because you take such obvious joy and find their insights so insightful. So it's a win-win-win-win-win. But you talked about community.
Mm-hmm.
You talked about creativity, and you talked about enlivening. You talked about joy. Those are not words that our community at large tends to associate with dementia, for sure. So let me ask you then, given your own personal experience, given your professional experience, where do you think changes need to happen, society-wide or citywide, talking about Philadelphia, to enhance the quality of life of people living with dementia? What kinds of changes do you feel need to be made?
Well, I think a lot of them, having experienced a life care community, and a nice one, a very, very nice one. This was one in New York. I would be in a room with my mom and maybe 18 other people who had the same diagnosis, and they would put on Wheel of Fortune on the TV. And I remember one time there was a young man who was one of the attendees, and it was a handsome young man, and my mother, and everybody's sitting there with their heads down. Nobody's paying attention to this. But my mother saw this young man and she wanted to sit next to him. So I asked if she could sit next to him, and he was, totally fine and happy about it, and started talking with her. And she'd be in and out there, but she was just happy sitting there. So when I would visit these life care, my mom's life care community, which, like I said, was a very, very nice one. We knew that she was taken care of, and the people who worked there certainly were kind and all of that. But I just feel like there was no real meaningful interaction. Putting on a TV show. And sometimes, when she was in earlier stages playing certain games, some people were involved, some people were just sitting there. So those that are just sitting there, I'm not saying that one needs stimulation all the time, but just to understand that you could play music, you could bring out crayons, you could play with, you could bring out tissue paper and have colors. It doesn't have to be complicated. I remember watching my mother once. She had to be hospitalized, and she was so busy touching the blanket and just rubbing the sheets. And I thought, she needs something tactile, and I'd sit with her in the dining room, and she would rub the dining room cloth. The tablecloth, I'm sorry. And I just started, I would bring her different textures and she used to love clothes and patterns, and, and just bringing that kind of thing, or holding my phone up to her ear and playing Frank Sinatra. The last few years of her life, she didn't talk a whole lot. She couldn't say my name. I don't know that she knew my name, but I felt like she was safe. She felt safe enough. She didn't feel scared. But and one last thing I'll just say is that another time she had to be hospitalized, and it was 4 months before she died, and she was having minor surgery. And one of my sisters and I were there, and I remember thinking, she is so intuitive. She knows something's going on. She's getting scared. We were just singing to her. You could sing. There's the other thing. Just singing was such a nice thing, but we were singing to her, and the surgeon came in just to see her. And then he took us, to the side, because we had to do do not resuscitate and all that kind of stuff. And he said, she's still in there. She's still in there. And it was so important that he could say that, because you lose sight of that. And I think that what is really important in terms of change and the way we address this community is to be respectful. Like I keep saying the same thing. These are sensory human beings. They will know if it's cold. They will know if it's hot. They will know what they see. They will know what they hear. They will be, if you rub their hands, that touch, that feel. And if you do that with consistency, I used to feel badly because I could only get to New York. There was a period when I was going up like once a week, but I'd spend the night, sometimes a couple of nights if I could. But when I felt like I felt badly, because I just felt like if she had that stimulation every day of being with somebody that, who was willing to rub her hands and talk to her, even if she wasn't responding, tell her, the last thing she ever said to me was, I was with her I was sitting with her, I was with my nieces, She wasn't responding to anything we ever were saying. I was telling her about my son, her grandson, who she adored, Ben. And I said, Mom, Ben is getting married. And she used to like to take me shopping. Like I said, she loved clothes. She always wanted us to look nice. And, would you go shopping? Would you buy me a dress? This went on for 15 minutes. And I'd stop and I'd start. And then I said it one more time, and she turned around to me and she said, I'll buy you the dress. Like she was annoyed with it. But talk about a gift. And that was exactly, it made me feel like that's what the doctor was saying. She's in there. She just has such a hard time putting together her thoughts. There would be times when I go with and be with her and she'd just start to cry. And I think, is she frustrated? Is that what's happening? So to see, I think the healthcare community has to do it differently. Like I said, she was well cared for. These were kind people. Look, I know family is going to be more than an employee, but I just feel that not to try more, because I think you'll get a response. Just the way when you bring people into the museum with their care partners, or who may be a spouse, maybe a child, maybe a nurse. As long as there's a sense of safety. We've certainly seen people who get uncomfortable or agitated, and we know that's part of the disease, and it's why not to fight it. Sometimes we take people for walks. Okay, we can leave the group, go outside. I remember one time I brought my mom outside, and she just wanted to put her face in the sun, to feel the sun, and to deal respectfully with people that way.
Absolutely. I think it's truly remarkable that her surgeon said the words, she's still in there, because one of the things that you've said and that we believe at Arts is that healthcare needs to do it differently. But there is an example of someone, we have a saying at Arts that if you've met a person with dementia, you've met one person with dementia.
Right.
And what you've just reminded all of us is, if you've met one physician, you've met just one physician. And, we use these blanket terms, healthcare professionals. It is the case that there are more and more healthcare professionals who really do get that some is still there. But how wonderful to have that acknowledgement. But I think, particularly in light of this conversation around creativity, I think your emphasis on recognizing that people are sensory beings, and that whether or not they're communicating with us in a way that we're comfortable with, that their senses are, some of their senses are among the last things to go, as we say. So the kinds of connection that you describe based on sensory experience, and you're saying it doesn't have to be complicated. I think that constellation of changes that you're advocating for is absolutely what we need. I think, you know, for many people, regardless of diagnosis, looking at art, having something to say about art is a scary thing, right?
Mhm.
People are scared of art. But it seems that people living with dementia, for a whole variety of reasons that we won't get into here, lose some of that fear.
Oh, I think so. I think
And
so.
so for them, art becomes that vehicle for connection, the connection and community that you talked about. So I think,
Well, there's a self-consciousness, I think,
yes,
that disappears,
right. And it's,
which is, not, which is a good thing.
it is a good thing. I mean, we basically say that when people experience dementia, they lose their executive function. And perhaps it's in part the loss of that executive function that tells us what to do when and how to decide this and how to filter that. When that is not dominant anymore, lots of things become possible. So
I also think that's true for an artist, whether it's a visual artist or a musician or a writer or a poet, dancer. When you stop critiquing yourself or becoming so, you're out of the process. You're
yeah,
out of it. But when you are just what we use the word flow, but when you're in the flow, you're not thinking, is this right? Is this wrong? Is this good? Is this bad? You are just responding.
yes, absolutely. And you know, there is something to be said for taking that lesson to how we interact with people with dementia too. If we enter their flow
Mhm. Mhm.
and follow their leads, and focus less on holding on to what we feel comfortable with and just kind of take a leap, and follow, that's when you get responses like, I'll buy you the dress, right? That's
Right.
such a wonderful, wonderful story.
But I must say, Susan, that that's what happens in an arts program. That, it's like I said, it's a journey. And I couldn't predict it. And who I'm talking about. You were looking at, it was an online program, and you were looking at the work of Gilbert Lewis, and he had done all these portraits of people in a nursing home where he worked. And, one person was looking at this portrait of a man holding a little bird, and he said, that collar is way too big for him. And it was something that nobody had ever noticed before.
Mhm.
And then he had numbers on his shirt pocket. What are those numbers about?
Mm.
And, clearly this was a man who had aged, who had shrunk. He was wearing a shirt that was too big. I don't know what the numbers were on his pocket or what that meant, but to even ask, to notice. And I can tell you, that's why, how many times have I said to you, I would like people who are in this program to write the labels for our paintings and artworks, because, looking, I don't know if you'll remember the Teresa Bernstein painting of
Yeah.
the people at the market.
Mhm.
And somebody said, wait a minute, there are only women here. Now, he was also noticing the hemline, you could see some ankles and you couldn't see some, like the dresses, some dresses were to the ground and some you could see the ankles and a little bit above the ankles. And he was noticing that. And this was somebody who did have aphasia, and the conversation continued and continued. And then he said, what year was this painting? And it was 1917. And I remember sitting there thinking, nobody here put that together. Nobody on the museum staff. There were only women at the market because the men were in World War I. They had, fashions were changing, and that was less relevant than the fact that he noticed that there were only women at the market. And then he asked year.
Yeah. Yeah. And it should be said, both of the participants that you have been talking about were both people living with dementia.
Yes, I didn't. Yes, absolutely.
And so you've kind of anticipated a question that I was going to ask, given your unique position as a museum educator, what do you think museums can do to create the kind of, or to help facilitate the kind of changes that you've talked about?
Well, I don't know if I don't know, other than, partnering with arts and having these programs, but because we both participated in I think it was the first international conference of medicine, dementia, and art, or art, dementia, and medicine, something like that, in London, with people from all over the world. One of the things that I learned was, I'm trying to remember what it was called. Was it social medicine?
Social prescribing.
Social prescribing, where the healthcare community, medical people, work with social workers to identify different ways of engaging the community. And so whether you're exploring going to a garden, or you're exploring going to an art museum, or you're exploring doing some kind of hobby, or that you are in a community. So it's not just also the care partner or the nurse or the aide taking this person with the diagnosis. You're joining a community that's maybe going on a garden walk, and together. And I think I would love to see something like that in this country. And I would certainly, advocate for Woodmere to participate as a venue. We also have gardens here. We're fortunate enough to have 6 acres of land, and more with our new purchase, but and to be able to provide those kinds of experiences. I think one of the main jobs of the education department at an art museum, I guess at any museum, is to create meaningful connections between objects and people. And meaningful, what does that really mean? Just, I don't know exactly, but you feel that people are engaged, that it's inspiring, maybe memory or experiences, and people are bringing, and look, we all have different experiences in life and come to the same, whether it's the same dinner table, or it's an artwork, or it's a piece of literature or a movie, and we may look at it with different lenses because of our experiences. But that makes the experience of looking, let's just say, at an artwork, that much more meaningful, because it's not just about what I see. It's about what you see. It's about the fact that there's space to see it differently. There's also space to think about it in a different way, in a new way. And that's what happens. That to me is meaning. I don't know if I'm defining meaningful, but that to me is a meaningful experience. And it's because I'm making this connection. And there's so many stories about people's lives in arts programs that comes out in a variety of ways. You know, whether it's remembering the egg breakfast that my mother made, or the love letters that my husband used to write to me, or whatever it, you know, it's, and it's just such a fascinating experience. And it's, I mean, the other part of it is that I really do think, and I don't know a whole lot about this, but I really do think that people who are in research and neurological research could really benefit from, I mean, yes, if they came up with a vaccine or a shot that could cure dementia, how wonderful. We, you know, or even a way of boostering, or, you know, I'm thinking about COVID, but until that happens, to live like there's nothing there until that happens, to me, is doing a disservice to so many people. And I think if researchers could be seeing the power of your programs, of the programs in which people are, this to me is a laboratory that's so rich. And, you know, and those who know how to can take, you know, can take cognitive diagnoses of what happens. I mean, and how many times have you heard, Susan, as people leave your programs and maybe go out to lunch with one another, like they just feel that their loved one is just more aware, you know, that there's a little bit of restoration maybe that's happened. It may be short-lived, but it's there.
Yeah.
So I guess another part that I would like to see is research, you know, clinical people working with organizations like arts to conduct research and get data.
Right, right, absolutely. And I think, you know, there's an example of the Museum of Modern Art in New York, where there, over the years, there has been pairing of some clinical analysis with some of the experiences. But I think, so if I can just recap, I think one of the things that you've brought up, which is, you know, I mean, we in the States are a little bit behind. And so the notion of social prescribing that you spoke of, where literally physicians are prescribing, you know, fresh vegetables, fresh fruit, Mediterranean diet, visit to the museum 3 times a week. You know, that is something supported by a number of national governments, including the English, including, I mean, it happens in Australia, it happens in Scotland, it happens in Japan, it's starting to happen. So that's one thing. But then the importance of museums doing what Woodmere is doing, which is to become committed to being the venue that is prescribed, right? And to doing all that only a museum can do. So there's something truly unique about sitting in a gallery surrounded by visual works, but also at Woodmere, I mean, we've been surrounded by oral works, you know, works that make sound. That is truly the laboratory, as you say, where people can experience things and connect with each other while they're doing it in a way that can't happen elsewhere. So I think, you know, the importance of museums and art centers and other cultural organizations in creating the places where these experiences can happen, I think is definitely
Well, we are all about providing experiences,
sure.
and we happen to be an art museum, so it's through art. It's also through nature.
Mhm.
But it is, I mean, we gain so much more from it too, because we learn not just, we see the impact. We don't know, you don't always see the impact of art. You do see the impact with an arts program. You just see how, I mean, it's like we've all been, it's like we finished the program and I feel like, okay, I'm refreshed for the day. I'm ready. It's just, no, it's wonderful. And also I want to say that the times when we've made art here have been truly wonderful.
Absolutely.
With children, more and more people, and there's science behind it now too, see play as a learning experience. That's what looking at art can be too. It's fun. There are surprises. And even if you don't like something, it's good. you have a strong response. And I also think that somebody else said this isn't from me, but I think about this with arts a lot, that I'm paraphrasing, but sometimes it's the artist's task to find out how much music you can make with what is left. And I don't think that's just true for people with dementia. I think that's true for all of us. And it may not be something that an artist is, I think most artists are not thinking about that. And maybe the word shouldn't be artist, but should be art in any form of it. It could be theater. Like I said, it could be, a film. It could be an artwork. It could be all of us, how in tune are any of us with all the possibilities inside of us? And how much do we, to get through our days and to get through our work and to get things done and all the tasks that are part of being a human being and an adult in this world, we neglect things about ourselves. And so I think when we're working with the arts community, I think it enlivens us. Because all of a sudden I'm going somewhere where I haven't been in a while. It's like, oh yeah, I remember that part of me. And it's a spontaneous thing and it's fresh. There's a purity to it. Anyway, and it's also recognizing, what is left? What do I want to pay more attention to in my life? Of course, then arts is over and you leave and I come back to my desk and I'm busy trying to get things done and, and getting irritated and, all the stuff that's normal in one's life,
But I think what you're saying is something that it's so important for all of us to remember, which is, I have a wonderful friend and colleague who founded an organization dedicated to engaging people with low vision or who are blind, often with art, and primarily through the sense of touch. And her conviction, which is borne out again and again, is if you think that a touch tour is just a niche service that only affects people who have low vision or are blind, think again.
Mhm.
Think of what each of us gains when we are allowed to experience through touch. And I
Mhm.
think, Hildy, you're making the same point here, which is we think of people living with dementia and to a certain extent their care partners as them.
Mhm.
And what you're saying is that if we think of them as us, then we are all better for it. And what our participants in Woodmere's and Arts's programs experience and share is our experience. Hildy, is there anything we've gone all over the place? Is there anything that you think we should have touched on that we didn't touch on?
Well, I guess one thing I just want to make sure that people understand too, is that I think, in being able to participate in these programs and watching how you do it or one of your other facilitators does it, in terms of, there's a tremendous amount of skill that's happening, and part of it is that you're listening, which we don't always do very carefully because our minds are wandering and we're thinking about something else or the next thing on our plate, but you're listening carefully. There's a just repeating so that everybody hears it, but I don't want to downplay that because it's important, because we don't always hear it. And being able to ask the next question that relates or doesn't, but that we follow this path, that I think you become also the teacher for care partners
Mm.
in your patient. You can lead, you can progress a conversation, based on what you're hearing. You're not, I mean, you may have a starting point, or you may have something, that you'll just pull out of your sleeve here and there, which is always good too. But the fact that, and I know some care partners have actually said this, but I think this is a really important aspect, is that because they have participated in programs with their loved one, and then they can go somewhere else, that they can use those questions or your way of making a conversation, having people notice, asking, digging deeper into what they said, gently, very gently. I think that's a really important aspect, because a care partner, it's so easy to feel drained. It's so easy to be frustrated. There's, there may not be any time for yourself, which is another thing that arts offers, is time, cafe for care partners, or music, or so, and replenishing those that are busy caring for others, and knowing that that's such an important aspect, that I mean, it's about nobody losing themselves, not the participants, not the care partners, but finding a new way to connect, or weaving it together.
Mm.
You don't always know how to do it.
Well, I feel as though we could have part one, part two, part three ad nauseum talking about creativity and Woodmere and you and education and art. And But I really appreciate your spending this time with me and with our audience today. And I feel as though arts has been plugged in so many different ways by you during this conversation. I just want to say that it is absolutely the case that had Woodmere not taken a chance with a little fledgling organization, we would not be celebrating our 10th year. And there are a lot of people who are part of the arts community or have been, who feel at home at Woodmere. And I think that is something I would add, which is Woodmere has made it a priority, from trustees
Mhm.
to director to staff to volunteers, to create a welcoming, receptive space for the people that we serve together. And I think that's a lesson to other museums.
Well, thank you. I mean, I can say that the staff here is always very accommodating and welcoming and wanting your programs in the museum, thinking that they're important.
Well,
And
thank you.
I think it makes everybody feel good.
And that is certainly what we aim for. So Hildy, thank you so much for spending time with us. Thanks to all of you who have been watching or listening. This has been another conversation about change, all in the service of ensuring that we think every day about how to enhance the quality of life of our community, our fellow community members who are living with dementia, their care partners. So thank you for joining us, and we look forward to seeing you again.